Hello, everybody, and welcome back to episode 41 of CCA's Medical Minute, sponsored by Kroger Health. We are really happy to have with us today Doug Cornelius. He's the National Director of Pharmacy Operations for Kroger. We were just talking offhand a little bit and before we came on, and I don't know that everybody really appreciates the full scope of that and how big that is. And so, Doug, could you start out by telling us a little bit about how many pharmacists you have, how many technicians you have? And then we'll talk a little bit about the size of the Kroger Health Division as well.
Yeah, it's really deceiving because you see that your local neighborhood Kroger, and you might see another one nearby, and then when you hear it's 2,254 locations with a workforce of 7,000 pharmacists, 11,000 technicians. We're a meaningful healthcare provider out there. I'm really proud of those guys. So proud to wear a pharmacist coat. I am a pharmacist.
I see it says pharmacist right there. Yeah, that's right. No, that's incredible. 18,000. So, one thing, just out of curiosity, I was just thinking about as we were kind of talking a little bit earlier as well, is like where does that put Kroger? Because you've got Walgreens, you've got CVS and things. Where does that put Kroger on the landscape in terms of size, pharmacy?
Yeah, that's a great question. When you look at the footprint across the United States, we're 3% of the brick and mortar pharmacies.
Really,
but we're the number 4 pharmacy provider in the country.
3% of the brick and mortar locations?
Yeah.
Wow. Okay, that's a crazy metric. Sherry, what do you got?
Well, with all these pharmacies, you're helping a whole lot of people, Doug, and it's so good to have you in the show this morning. We were talking with Megan Brown recently about collaborative care, so we know that that's integrated in the pharmacy segment as well. How are you able to help patients through your pharmacies beyond just writing prescriptions, especially cancer patients?
Right, not just putting that pill in the bottle. What else do we do? So, my first real strong experience was this guy named Frank back in the 90s when I was a young pharmacist, and we had this good relationship because he came in regularly for his medications, and we'd occasionally, hey, how's this working for you? How you feeling? And then he comes in one day to tell us that his wife has dementia.
Oh, wow.
And we walked that journey with him. And it's because we had built this emotional connection with him that you're coming into the grocery store regularly, you're coming into the pharmacy at least once a month, and you're building a relationship with a newfound friend, right? So we certainly help people get the products that they need, but we're also that extra set of eyes and ears on how they're really doing. So when you talk about a patient with cancer doesn't live just in that bubble, right?
Yeah.
So you've got the treatment to go in and kill that, but they may have already had diabetes and hypertension or anxiety. So that part of life still has to continue on too, right?
Yep.
So that's where our pharmacists really jump in. They build a higher level of connectivity with the providers and making sure that the medications are still fine, that there doesn't need to be any dose adjustments, or maybe we suspend a medication for a while because of the level of treatment that you're on with oncology. So there's a lot of give and take. Now, the tough part is the EMR systems they haven't evolved to the level where pharmacies have easy access.
Right.
Okay. So it's still old-fashioned phone calls.
Really?
And I think that's one of the really nice things about pharmacy too. You can use technology, or you can still go back to the old-fashioned walking in and talking to somebody 7 days a week.
Now, not so old-fashioned that there's like whiskey behind there's not whiskey.
Most of them there's not.
Okay, all right, gotcha.
Well, if you take some medication, it almost equates to a little bit of whiskey.
That's
My mom used to
point.
give us 3 6s when we were growing up. I don't know what if you even remember that, but it was so horrible. It might as well have been something similar to that.
Yeah. So, Doug, just this is curiosity. I know, like in some of the businesses I've been, they're always driven by metrics, right? So, what kind of metrics do you guys use? Is it? Obviously you're going to focus on, I'm sure, number of prescriptions filled, but are there any accuracy-based metrics? What are you guys really paying attention to?
Yeah, that's a terrific question, and something I'm really proud to talk about. So our leadership, whether it's Colleen or it's Rodney, have really talked about we want to fill less prescriptions per patient.
Okay.
And it's because we're evolving their overall health.
Okay.
So what we start looking at when it comes to quality of care is how adherent is a patient. Are they getting their refills on time? When we talk to them, are they taking their medications correctly? We can measure those things. And then we go back and we just double check to make sure that data is actually what's going on. So we're very proud of adherence. And then, of course, the top thing is safety.
Yeah.
I mean, every system that we build is for additional safety and to give the pharmacists and the technicians more access to the patient.
Okay.
So let's take the mundane out of the process. What if we used robots to count pills? I mean, it doesn't take a whole lot of manipulation to do that, right? So let's do that. Let that technician start talking about, hey, David, notice you haven't had your shingles vaccine yet.
Okay.
Can we get that ready for you today? So those are the metrics that we look at. Are people getting vaccinated? Are they adherent?
Okay.
And that's more important to us than prescription count.
You just brought up something really interesting, though, but are there any mechanized methods, though, to count? Because I was actually going to ask you about that, because it wasn't that long ago that I saw someone still kind of
counting up.
Yeah. So we have a fleet of over 500 robots across our 2,200 stores. And they fill anywhere from the top 100 to the top 150 medications.
Okay.
And then I'm also responsible for 4 central fill sites.
Okay.
So you call in your refill, your prescription. You don't need it until 2 o'clock tomorrow.
Okay.
Prescriptions filled off site by a state-regulated pharmacy with Kroger Associates. It's delivered to the store before you show up.
Wow.
And that's innovation, huh?
Yeah. So we take that off the pressure on the store.
One of the things that I was really curious about finding out is I know that many of the pharmacies across the country now have specialized services. So I believe you all do as well have an oncology specialty service.
We do, yeah. It's in Lake Mary, Florida.
Okay.
My friend Kevin runs it down there. Great guy. And they do. They fill the prescriptions. They have nursing teams that check in on the patient, interact with the total healthcare ecosystem to make any adjustments that might need to happen. And then they've also got that whole financial side. Okay. So these folks that are dedicated to coordination of benefits.
Oh, yeah.
Coordination may involve bringing in any kind of rebates that a manufacturer has for that medication that lowers the cost to the patient and the family.
Well, what I like, though, is that you said you have people that are calling the patients and checking in. That's so important, especially when you're going through something like cancer. You have, it's like another person that really is, cares about your health and trying to help you manage.
Yeah, absolutely.
I am a recent victim of the coordination of benefits thing. So I didn't realize which was primary and which was secondary, and that's been a lot of fun trying to get that untangled. So with going through what I'm going through, so I had there was a point I had about $100,000 in bills.
Oh man!
It's all starting to sort itself out now because they're going back through and reprocessing. But man, it's a pain.
Yeah,
it is a pain. But so the specialty pharmacies, do they fulfill nationally?
They do.
Okay, do they drop ship?
Yeah, and that whole side of thing is very exciting and complicated at the same time. Yeah. I thought moving COVID vaccine around the United States was tough, but what these guys do to ensure the integrity of the product, the timeliness when your next dose arrives, and then making sure not only you got the medication, but you got the supplies that you need in order to administer the medication.
All right. So, quick question. Can we have you back sometime?
Absolutely. I love to be here. Yeah,
all right,
great conversation.
Especially now that you're in Cincinnati.
I am, yep.
Were you always in Cincinnati?
I actually went to Ross in high school and then went up to Ohio State to watch college football. And I also got my pharmacy degree while I was there.
Do that. Yes,
right?
Before we let you go, I want to ask, what most do you want our audience to know about Kroger pharmacies?
Yep.
Yeah, I'm just really so proud of our teams that are in the stores, whether it's the technicians or the pharmacists, always looking out for the good of the patient. If the patient can't afford their medication, then what's the value of the prescription?
Yeah.
So finding the best ways to get the medications home with the patient and then following up to make sure, hey, are you taking the medications the way it was intended? Prescriptions are really an adjunct to overall health care, right? So that's that first step on somebody's path to wellness. And we want to help them get there and then also learn more about food as medicine. So maybe we'll talk about that next time.
No, that'd be really good because we've had a couple of those conversations. So that's good. So we will have Doug, the pharmacist, back at some point in time, who also happens to be the national director of the pharmacy operations. But it's been great. Thanks, everybody, for tuning in. Thanks, Doug, for joining us today. We'll have you back soon. And take care and have a good week, everyone.